This is the one skin cream nobody has told you about. Why has no one told you about this one? Why is it such a secret? The estradiol treatment produced a 23% increase in epidermal thickness. That's huge. That's a quarter of increase of thickness. Well, maybe it isn't a secret because in my community poll I posted the other day, 13% of you are using this for skin thinning, to combat skin thinning. It's number 2, only behind retinols. 64% of you are using retinols to combat skin thinning. Now, do you know what the number 1 reason is for skin aging for women between the ages of 40 and 50 and beyond that mark is? Well, it's estrogen loss. I see it in my clinic, and this bears out on 3D imaging when we study the face in my practice. Yes, even above photo damage and smoking, estrogen loss is the number 1 culprit. Now, this is the data that you want. Many studies have shown that upon entering menopause, women detect a swift commencement of skin aging symptoms. One of the first experience is skin dryness, followed by decreased firmness, decreased elasticity. These symptoms correspond with a structural and architectural change such as decreased sebum production, decreased collagen content, decreased dermal thickness, so, thinning, which we address a lot on this channel, and loss of elastin fibers. Why? Because every woman, no matter what, will lose estrogen. But many don't smoke and many don't get a lot of sun damage. It 100%, however, happens to all women, estrogen loss, unless you alter it a bit and safely replete it. So this article from the International Journal of Women's Dermatology. And if we look at the abstract here for a minute, menopause is a major turning point in a woman's life that is characterized by declining ovarian function and decreased serum estrogen. The resulting hormonal changes particularly affect the skin, with postmenopausal symptoms such as loss of structural architecture and increased propensity to damage becoming rapidly noticeable. Interestingly, studies have shown that estrogen deprivation in postmenopausal conditions accelerates many skin changes, including dryness, atrophy or shrinking, fine wrinkling, and poor wound healing. So this then begs the question, why not apply it topically? Why not apply estrogen cream topically to your face? Now, what happens to skin as we add estrogen back? Well, estrogen helps retain and restore skin moisture through the promotion of the sebum production and secretion. Skin thickness is key to looking younger, but the progressive decline in skin thickness in EDS, estrogen depleted skin, is mostly due to loss of dermal skin collagen and reduced rates of collagen deposition. Same with hyaluronic acid. Collagen levels in skin, and I talk a lot, type 1 and 2 collagen, that's what biostimulators put back, is the most prevalent and correlate with estrogen levels. So that's why you need it in the skin. When should you start it? Is it safe? Because I know I mentioned the word estrogen, everyone's immediately scared. Does it absorb into the bloodstream significantly? If so, which type? Can you use it if you've had breast cancer or uterine cancer? And finally, why has your aesthetic provider or doctor not told you about it and to use it? Oh, and by the way, I know you're wondering now, how much does it cost? It's inexpensive. It can be obtained very, very inexpensively. That's what makes it so tempting, since up to 30% of dermal collagen is lost during the first 5 years of menopause. If I could hand you 30% of your collagen back, well, that would be a miracle. For those of you a little younger and you're saying, well, I'm not quite at 40 or 50, I'm not having signs of menopause, Hormone, and particularly estrogen and testosterone depletion, are starting at a younger and younger age. We're seeing it in people in their 30s. And because the term menopausal does not encompass the broad range of age of women who experience these symptoms, we prefer to use the term, you'll see this, estrogen depleted skin. And estrogens are steroids that are synthesized from cholesterol, the very thing that we were told is bad. But we need cholesterol. I talk about that all the time. So cholesterol in the ovary in premenopausal women and in the peripheral tissue in postmenopausally. And it sounds odd, right? Placing a vaginal cream on the face? Well, that's a hack that's all over TikTok that I'll describe exactly what and how today, because maybe you've seen it there. So what exactly does estrogen cream applied to the face improve? It reverses skin thinning, it improves facial fat pads, it boosts your collagen production, and it alters skin hydration and even collagenases, which are signals that break down collagen, and it helps improve your hyaluronic acid content and signalers, because as we age, we don't make as much hyaluronic acid that of course makes us look younger when it's robust. Before we go any further, let's address number one. Does it really work? That's the elephant in the room here. Let's establish this and see what the studies say. We'll look at one study here, but let me give you a spoiler alert. After over 25 years of seeing patients and imaging patients, so what I see, what they see, and objectively on scans of their face, I know the answer. But to keep me honest, let's look at this study. It's actually very interesting because it includes AHAs. This is a great article here. Look, the effects of an estrogen and glycolic acid cream on the facial skin of postmenopausal women, a randomized histological study. So we like that. Histological, we're looking under microscope at the skin. Let's look at it. So this was a prospective, randomized, double-blind study. That's a great study. It was conducted to determine if estradiol, that is the potent estrogen, and glycolic acid, you'll know that from my AHA alpha hydroxy cream, that's an alpha hydroxy, or the facial pads that people apply, that's an exfoliant. If they produce a significant reversal, I love that word, reversal, of epidermal and dermal markers of aging, and if the cumulative effect of the creams was greater than either one alone. So did the estrogen help? Did the alpha hydroxy cream help? What did both of them do together? Was it additive? Wonderful. 65 patients. That's a really good number for a derm study. Applied a cream containing, look at this dosing, 0.1% estradiol. Where'd you hear that before, right? That was from that Estraze cream, okay? The vaginal one, the TikTok hack that we're talking about. That's a 0.01% or 15% glycolic. So that's a good dose of glycolic, 15%, alone or in combination to one side of the face, and a vehicle cream to the opposite side. Now this was for 6 months if you want a guideline for that. But look at this. A 2-millimeter punch biopsy was obtained from the hairline, because do you want a punch biopsy taken from the middle of your face? No, take it in a conspicuous area of each patient and process for analysis. Look at this. I'll let me clear our screen so you can see better. The estradiol treatment produced a 23% increase in epidermal thickness. That's huge. That's a quarter of increase of thickness. The glycolic acid produced a 27% increase. Huge. So many of you are already on a glycolic, so you're doing the right thing. Get on the glycolic pads as well, the wet moistened pads. But look at this. All groups showed a statistically significant improvement in reversing the markers of skin aging. Although not statistically significant, a cumulative effect was seen when estradiol and glycolic acid creams were used in combination. Well, this only makes sense. But you see, both of these work for increasing the skin thickness, but estrogen is certainly one to consider, and we see that it works here as a standalone or really in combination. Let's have a quick insight right now into what I mean by estrogens on the face. There is some confusion and there are different ones. Estrogen is used to group 3 female hormones: estriol, estradiol, and estrone. When professionals talk about estrogen, they generally refer to estradiol. This is the hormone that makes up the highest concentration in your body at about 80%. Estradiol is the most common hormone found in women of childbearing age, youthful women therefore. Estradiol is responsible for, it develops those female characteristics: the breast tissue, the breast development, the wider hips, the overall fat distribution. Keep that one in mind. It's also essential to help maintain female reproductive tissues and other tissues such as skin, but also liver and bone. Do you see the highlights I'm giving you here? Skin and bone, as we talk about all the time. Key, important for the healthy female as menopause approaches. Now, my comment on fat distribution might spark interest from you because as we age, as estrogen declines, climacteric and that menopausal time approaches, fat redistributes such that it's more in the truncal area and lower down in the belly area and less up high. And that fat redistribution is something that drives people crazy as hormones decline. So estradiol helps maintain all of that and keep a youthful, fertile female looking in that attractive shape that people are after. Now, estrone is another one. This is typically higher post-menopause. And like estradiol, it does help support the female sexual development and function. But again, you see it post-menopausal. Then there's estriol. I want you to pay attention to this one because it's only about 3% of the total makeup of estrogen, and it is considered one of the weakest hormones in the estrogen family. This is going to be key because we want whatever we're putting on our face to be strong enough to work on the skin, but we don't maybe want it to go into our bloodstream, and we're going to get into that now. But estriol, keep that in the back of your mind as it comes up through this video. It's a key one to note. Often it's called the good estrogen for what we're talking about today. Now, remember that TikTok hack I was talking about? Well, the reason it's kind of a hack is they're using a vaginal cream for the face. Each gram of what's called Estraze, which is estradiol vaginal cream, it comes at 0.01%, which is often what's studied, by the way. It contains 0.1 milligram of estradiol. That was the first type of estrogen that I talked about, the one that's most abundant in youthful females. Many people who are on hormone replacement therapy will ask me, do I need to also put it on my skin? Now, the advocates of topical estrogen will tell you that it's been shown to be safe and effective in preventing skin aging, even for those already on hormone replacement therapy. There is, in fact, a study published in February of 2007, a group of women who are already taking oral estrogen, so by mouth. They were given a topical 0.01%, no surprise, we talked about that Estraze cream just now. And after only 4 months, both dermal and epidermal thickness, so 2 layers of the skin, were enhanced, as well as dermal collagen levels. Both phenomenal findings. This study showed that the topical estrogen application provided a rapid and definitive anti-aging effect even in women who've had high systemic estrogen blood levels. So if you're taking hormones by mouth, by applying it to the skin also, it shows that there's likely receptors there, but certainly that there's benefit there applying it on the skin. This also shows how quickly a small amount of estrogen placed on the skin, directly on the skin, induces a profound anti-aging effect. So that's estradiol. Now, estriol, that's the weaker estrogen. When estriol is given systemically, so orally, It's very, very weak, like we said. But in Austria, they did a study where they used it topically, and it was a 6-month study, and it was of peri and postmenopausal women. And this was at the University of Vienna in Austria, and it compared the topical application of estriol and estradiol, the strong one. The doctors found that the skin improvements of aging improved, but here's the thing. Those treated with the estriol, the weaker one, obtained superior results with no systemic hormonal side effects. Let me say that again. No systemic hormonal side effects were noted in that study. Like I said, in the USA, you're going to get that through a compounding pharmacy, as it's not FDA approved for other uses. But keep in mind, proponents of this type of therapy will find some data in every single study to say that there are no systemic side effects. But here's the kicker. You can measure the estrogen levels and say, okay, well, they didn't go up. You can say, well, they didn't have any quote unquote side effects. But when you ask the patients, then they might say, well, I had a little bit of breast tenderness. My hot flashes decreased. So the problem here becomes the patients do have systemic changes. The wording gets tricky, indicating that there is something going on in the body with absorption, but yet maybe we can't measure the levels. So what I'm telling you here is there are some precautions to know about. Now let's look at this study to help guide us through this part. Now, for those of you reading books about menopause, Edward Lichten, MD, the author of the textbook Bioidentical Hormones, he reports that there's no estriol detected in blood, so you can't measure any estriol in the blood of test subjects who used this topical estriol cream. Another popular book, Dr. John Lee, the author of books like What Your Doctor Might Not Tell You About Menopause, in those books, you're going to hear him say that estriol applied to the skin reverses wrinkling and should be an essential part of anti-aging skin regimens. Now, he's Harvard trained, and he wrote this exactly. Estriol is the safest natural estrogen. So I think that's one way to put it. It's the safest. Does that mean it's safe? Well, it's the safest. You're always stratifying risk, no matter what you do or what you take. Now, here's one of the big issues. Increased longevity in today's developed societies is resulting in an ever-expanding elderly population. You see, it's not well studied because people didn't live this long before, so we never had to think about replacing it. Thus, the data is limited. Because women are living longer, but the age of menopause onset remains stable, although it's a little declining. It's about the age of 51. An increasingly larger proportion of a woman's life is spent in the postmenopausal state. And this is what we're trying to navigate. And remember, doing nothing also has risks. So this gets complex. Now, this is a review from the International Journal of Women's Dermatology. And from this article, should you take it? Although systemic hormone replacement therapy, meaning orally you take it, can reverse the signs of estrogen-depleted skin, such as skin and vaginal dryness and atrophy and the various risks that go with that. Here's where it gets kind of confusing. So side effects were mild, but look at this. Interestingly, one study reported that local application of estradiol gel on the forearm led to an improvement in the fineness of the texture on the application site. So change the application site. However, and here's the kicker, the skin on the cheek, which was distant from the site where the gel was applied, also had similar improvement, suggesting that the possibility of a systemic effect, meaning if you put it on the face, there's likely systemic effects. There were also people whose hot flashes improved, whose sleeping improved. So even though maybe you don't measure the estrogen in the blood to say, well, it increases it, there are hints that this is affecting us systemically. So that, and therein lies the concern and kind of the difference in messaging from the different articles based on using estrogen or estriol cream. Mixed messages as to the extent of absorption. So what should you do? Let's wrap this up into something actionable by you. Remember, every provider you see, and some of these of course are prescription ones, so you're going to need to see someone to get them. They're being very, very cautious about this. Low dose estrogens shouldn't spur any significant growth of endometrial cells when used for up to a year. That's what you'll hear people say. That up to a year kind of disclaimer doesn't help you a lot. Another problem here is how often do you use it? How much are you applying? So there's no real study to guide you by saying, yes, use it once a day, use it 5 times a day, use it 5 days a week, and then you might apply a small amount, someone else might lather it on, and you're going to get absorption systemically to some degree. So these are very, very difficult studies to do, and the answer is they have not been done. So we're looking at the data that we have and saying, how do you approach this? I think the best way to approach this is to bring it up with your provider. They're going to want to know your past family history of uterine, breast cancer, blood clots, and other things that estrogen might cause within your body. Now, if you're a breast cancer survivor, you should check with your oncologist before using estrogen cream. What does the oncologist usually say? Many oncologists are okay with patients using this treatment, but it can be a nuanced decision. And the approach may not be advisable for some women depending on the receptor status or the cancer, prior cancer, and the stage it was at. Although the science is promising and the estriol creams are slowly making their way into everyday skincare, they come with some serious considerations, there's no doubt. My approach is to tread lightly, keep an eye on the data, and for those with any doubt about family history, personal risk, or your own tolerance for risk, stick to the time proven and tested products I regularly talk about on this channel. For those who want the next level creams, have a risk tolerance that you're comfortable with, have a good clean family history for something like this, I think then it's a consideration. But also realize you have all natural options like PRF, like your blood draw, where you can get your own growth factors and stem cells. Now you have to go to a clinic for that, and you have to get them put in. So topically, they're not going to work that well, but you get them injected or micro-needled in. But the benefit is they're 100% autologous. They're coming from you. There's nothing exogenous. You're not getting other people's DNA, RNA, and you don't get the side effects that possibly one might get with estrogen absorption. And again, as I told you with that disclaimer, they'll tell you, hey, at 1 year, reevaluate, or it's safe to use up to 1 year. Well, you need more than 1 year, so you don't want to come off of something prematurely. 1 year doesn't do you good. You want to probably be on estrogen creams, you're going to be on them for the rest of your life. So there's the dose there we just don't know about in the studies. So if you choose to go all natural, I can see where that makes sense for many people. You're now going to want to watch this video on bioidentical hormone replacement and one down here on your blueprint skincare routine to simplify it, keep your skin and body beautiful, healthy, and vibrant.